One of the reasons I did this was my assistant was taking a picture of the bride walking into the reception, and I was in the background, just nonchalantly just standing there. And when I went to go edit that picture and zoomed in, I didn't even recognize myself. My face was swollen. I always do my hair and makeup, always, but it's just, that was a facade at that point, because if I had bigger hair and lots of makeup, people might not look at my body or realize that I've gained 200 pounds in 3 years. The next day I made the appointment to talk to them about the weight loss surgery.
In March of 2013, in the spring, I woke up one morning and my right foot was on fire. It was on fire. And that's when I knew I got a problem. This is no longer an emotional, a social issue. This was my physical health. I was gonna die a slow death. 3 months before my gastric sleeve surgery, I was 477 pounds. Today, 3.5 years later, I'm 222 pounds. So I've lost about 250 pounds.
Hello, welcome, and thank you for choosing to explore weight loss procedure options at University Hospitals. Over the course of this session, you will learn more about our specialized program and those who will be a part of your journey here at University Hospitals. We will also review obesity and the illnesses associated with this chronic disease, who qualifies for weight loss procedures, the various procedures our program offers, and requirements and insurance coverage for these procedures. To end the session, we will review the next steps to move forward with our program. If you haven't already done so, be sure to download the patient information booklet from the link just below this screen. It has valuable information about our program and tools to help you start the process right away. University Hospitals prides itself on high-quality care, patient safety, and convenience. Patients can choose to receive care at one of our 3 accredited hospital locations for bariatric procedures or at one of our 2 community clinic locations in the region. We understand that you have a choice in weight loss surgery programs, and we are very excited you have selected to consider University Hospitals. We offer many unique features that make us the program of choice. The first is that all 3 of our hospital locations are accredited bariatric centers with the American College of Surgeons. UH is the only hospital system in the state of Ohio with 3 accredited bariatric centers. Accreditation ensures safety and quality guidelines are followed throughout your experience. Second, our program is a full-service program that truly understands you. We offer caring, individualized patient education, and our team is available whenever you need us. We have immediate program entry, and you can receive your pre- and post-procedure care at any of our 5 locations. You may have researched other programs and noticed that some charge a fee to complete their program. Here at University Hospitals, we don't charge a program fee. It's our goal to make this life-changing surgery accessible to as many people as possible. Also, we perform a variety of minimally invasive weight loss procedures which shorten your recovery time and significantly reduce pain and scarring. As an added benefit, we offer free lifetime nutrition counseling for patients both before and after weight loss surgery with a team of registered dietitians. Our team is your team. We have a full complement of staff who look forward to working with you. Our surgeons believe in a team approach to your care. The surgeons in the University Hospitals program are board certified and fellowship trained with many years of weight loss surgery experience between them. You will be followed closely by our nurse practitioners. You will likely meet them during some course of your care. They work closely with the doctors to ensure you are receiving optimal care. Our program insurance specialists will work with you to help you understand your insurance coverage and obtain approval for your weight loss procedure. Nurse coordinators are located at each of our hospitals to support and guide you through your weight loss journey. They work alongside the surgeons in providing excellent patient-centered care. Our registered dietitians play an essential role in your success before and after your procedure. Each of our dietitians specialize in weight loss nutrition and provide education and guidance at each of our locations. Weight loss surgery is a life-changing procedure. For this reason, we have a network of behavioral health specialists ready to work with you. Choose a provider from our list located in the patient information booklet available for download on our website, or use your own preferred behavioral health specialist. Obesity has become an epidemic in the United States. More than a third of adults fall into this category nationwide. Typically, these adults spend an additional $1,429 per year on medical costs, totaling in the billions of dollars every year. Obesity is a disease that has many associated illnesses. You may also hear these illnesses called comorbidities. Many may suffer from some of the more common obesity-related illnesses, such as high blood pressure, diabetes, sleep apnea, or arthritis. The good news is, many of these illnesses are improved or cured as a result of weight loss surgery. Imagine improved sleep, less joint pain, and a better quality of life. This is what weight loss surgery can do for you. When healthcare professionals measure obesity, we use a tool called Body Mass Index, also known as BMI. BMI is a measure of a person's weight in relation to their height and is used to establish if a person qualifies for weight loss surgery. To determine your BMI, refer to the chart online in the left-hand column or in your patient information booklet available for download on this webpage below the video. To qualify for weight loss surgery, you must meet certain BMI criteria set forth by the National Institutes of Health. Those with a BMI of 35 to 39.9 qualify for surgery if they also have at least one weight-related illness. People with a BMI of 40 or higher qualify for surgery and are typically not required to have any weight-related illnesses. Those with a BMI between 30 to 40 may also qualify for a non-surgical weight loss procedure called the intragastric balloon. The qualifications for weight loss surgery can vary based on insurance company requirements. Our insurance specialists are available to work with you and your insurance company to determine what requirements must be complete before surgery. Obesity is a complex disease with both medical and surgical treatments. Medical treatment for obesity involves diet, exercise, and behavior modification. Some medical treatments for obesity may also include prescription medications available only from a doctor. Many of our patients have tried medical weight loss techniques but were unable to maintain long-term weight loss. This inability to keep the weight off long-term is where weight loss procedures become an option. Anyone choosing a weight loss procedure must modify their diet, exercise, and behavior. However, the procedure or intervention physically restricts the amount of food that can be eaten and can affect appetite, making sustained weight loss a reality. At university hospitals, we perform the gastric bypass, sleeve gastrectomy, as well as revisional surgery for patients who have had weight loss surgery in the past and are experiencing some post-operative challenges. Our program also offers a non-surgical procedure called the intragastric balloon for appropriate patients. Next, we will review the specific details of the weight loss procedures offered at university hospitals. Our team will work together with you to determine which procedure is best for you. There are two basic approaches to weight loss surgery: open and laparoscopic. With traditional open surgery, the surgeon uses a single large incision to enter into the abdomen. This large incision is associated with more pain, wound complications, scarring, and a longer recovery time after surgery. Laparoscopic, or minimally invasive surgery, uses several small incisions through which specialized surgical instruments are inserted. A camera transmits images from the abdomen to video monitors in the operating room. During the operation, the surgeon views the images of the abdomen on the monitor and performs the surgery using these instruments. This technique allows the surgeon to perform the same operation as the traditional open surgery, but with smaller incisions, less pain, fewer complications, and a quicker recovery. Surgeons who perform minimally invasive procedures are required to receive intensive training and are highly specialized in their field. At university hospitals, 98% of weight loss surgeries are performed laparoscopically. The gastric bypass procedure is the first operation we will discuss today. It is considered the gold standard of weight loss surgery and is the most commonly performed bariatric procedure worldwide. There are three components to the gastric bypass: the restrictive component, the malabsorptive component, and the hormonal component. These components work together to produce rapid weight loss after surgery. When we perform this operation, a small stomach pouch about the size of a golf ball is created by dividing the top of the stomach from the rest of the stomach. This is the restrictive portion of the operation because the small stomach pouch restricts the amount of food patients can eat, which results in ingesting fewer calories. Next, the first portion of the small intestine is divided. The surgeon then takes the bottom end of the divided small intestine, brings it up, and connects it to the newly created small stomach pouch. Last, the top portion of the divided small intestine is reattached to the small intestine further down the intestinal tract. This is the malabsorptive portion of the operation because the surgeon is bypassing part of the intestine that would normally absorb additional calories and nutrients. Bypassing 80 to 90% of the stomach impacts gut hormones, which in turn lessens hunger. The bypassed portion of the stomach, or the larger pouch, remains intact and working. It continues to produce stomach acids and digestive enzymes that will eventually mix with the food from the small pouch. When food is eaten, it will enter the small pouch and slowly move to the small intestine. The brain will signal the large pouch to make digestive juices. The food and digestive juices meet at the Y portion of the intestine, and digestion occurs here. Most importantly, the altering of how food travels through the digestive tract causes changes in gut hormones that promote a feeling of fullness and suppressed hunger. There are many advantages for patients having a gastric bypass. Since the gastric bypass has been performed for over 40 years, we have a tremendous amount of data proving its effectiveness. Patients can plan on losing an average of 50 to 75% of their excess weight after surgery. Most of the weight loss occurs within the first 6 months of the procedure, resulting in a rapid reduction in weight-related illnesses. Recent studies have shown the gastric bypass to be a more effective treatment for diabetes than medication. Other benefits of the gastric bypass include a quick healing time, feeling full quickly, and dumping syndrome. Dumping syndrome is a common side effect that many will experience after gastric bypass surgery. The occurrence of dumping syndrome is typically the result of poor food choices. Patients who ingest very sweet foods, such as cake and candy, or high-fat, fried foods like gravy or French fries, are at risk of having dumping syndrome. Symptoms include lightheadedness, rapid heart rate, and a flushing sensation that is often accompanied by diarrhea. We consider dumping syndrome an advantage in that it helps patients avoid consuming the high-sugar, high-calorie items that can be hard to resist. There are a few disadvantages to keep in mind with gastric bypass surgery. Since a portion of the stomach and small intestine are bypassed, vitamin supplementation is required on a daily basis. Caution must also be used when taking anti-inflammatory drugs like ibuprofen, as they can cause gastric ulcers. And you must avoid smoking, as it can cause life-threatening complications. The sleeve gastrectomy is another procedure option available to patients seeking weight loss surgery. Surgeons started using the procedure for weight loss in the mid-1990s, and it really started to catch on around 2010. This procedure is done by forming the stomach into a long, tubular sleeve. The remaining 80 to 90% of the stomach is removed and discarded. There is no alteration of the intestinal tract with this procedure. The sleeve gastrectomy is a restrictive procedure that works in two ways. First, the new sleeve holds a smaller amount of food than a full-sized stomach. This significantly reduces the amount of food and calories that can be eaten. Additionally, the removal of 80 to 90% of the stomach impacts gut hormones, which lessens hunger. There are many advantages for patients choosing a sleeve gastrectomy for weight loss. Data shows that patients will experience a similar weight loss as those who choose the gastric bypass operation. Sleeve gastrectomy patients experience rapid weight loss, on average losing 50 to 70% of their excess weight. Other benefits include a quick healing time and the ability to feel full quickly after eating only a small amount of food. There are also a few disadvantages to keep in mind when choosing the sleeve gastrectomy. First, it is a relatively new procedure, and therefore there is no long-term data on its effectiveness. Unlike gastric bypass, this procedure is not reversible, and since a large portion of the stomach is removed, vitamin supplementation is required on a daily basis. The intragastric balloon is an innovative procedure available to a specific group of patients looking to lose weight. The procedure is performed under light sedation by inserting a deflated balloon through the mouth and esophagus into the stomach, eliminating the need for incisions and scars. After the balloon is in place, it is filled with sterile water to about the size of a grapefruit. The balloon is left in the stomach for 6 months and restricts the amount of food that can be eaten. During this time, patients participate in a personalized diet and exercise program to encourage portion control and healthy lifestyle. The balloon is then removed using the same technique as the placement, and the patient continues to eat healthy foods and exercise to keep the weight off. The intragastric balloon is appropriate for patients with a BMI between 30 and 40. Insurance does not cover the cost of the intragastric balloon, but University Hospitals has a very reasonable package price for the balloon, which includes a comprehensive lifestyle program. The intragastric balloon can be a great weight loss option for qualifying patients. It is a non-surgical outpatient procedure that usually takes about 30 minutes, with the patient returning home the same day. There are no incisions or scarring. Patients are fully supported with a medically supervised nutrition and exercise program. While this is a newer procedure, studies have shown that following the 6-month program, patients lost an average of 3 times the weight others lost with diet and exercise alone. There are also a few disadvantages to consider. First, since this is a relatively new procedure, there is no long-term data on its effectiveness. It is important to note that this is a temporary device too, so patients must be disciplined in maintaining the healthy lifestyle program to experience success long-term. In comparing the 3 procedures mentioned, you will notice that 2 options can be done laparoscopically and the balloon is done endoscopically. The duration and recovery time vary depending on the procedure you choose. The bypass and the sleeve are the most effective operations when it comes to long-term weight loss and correcting the illnesses associated with obesity. The balloon patients tend to experience a smaller weight loss at a slower pace. Research shows that weight loss surgery significantly impacts the lives of patients who choose it. Several studies have found that obese people who had weight loss surgery have a lower risk of dying than obese individuals who did not have weight loss surgery. One study found an 89% decrease in the likelihood of death. This exceptionally high reduction in death rate is due to the rapid improvement of diseases that are caused or worsened by obesity. Examples of these illnesses include high blood pressure, sleep apnea, asthma, arthritis, high cholesterol, reflux disease, fatty liver disease, urinary stress incontinence, infertility, and diabetes. In the past, diabetes was considered to be an incurable disease and could only be managed with diet modification and medication. Today, there are studies and evidence showing remission of type 2 diabetes following weight loss surgery. Improvement or curing of obesity-related illnesses typically means patients can eliminate a large amount of prescription medications from their daily routine. In addition to improvements in health and longevity, surgical weight loss improves overall quality of life. Aspects of life that are positively affected by weight loss surgery include physical functions such as mobility, self-esteem, work, and social interactions. Unemployment and disability are significantly reduced after weight loss surgery, along with depression and anxiety.
I personally like to do things now. Like, I want to generally see people. I want to talk to people. I want to interact. I want to try new things. I want to go out. Since the surgery, I don't have any medical issues. I did a 5K, which was kind of a big feat for me to be able to even walk. I started bike riding, which I really like to do, and then walking my dog, which I've never been able to do.
Each of the procedures offered at university hospitals has its pros and cons. As a patient, our team will work with you to choose the best option that will be the best fit for you. The journey to a weight loss procedure can be overwhelming. However, University Hospitals is committed to providing you a comprehensive and safe care experience. For this reason, every patient meets with our team of experts before surgery.
I am very inquisitive. So when we had our meeting, my best friend came with me and took notes on everything because I would not have remembered anything that we discussed because I had so many questions and what ifs and what do you eat and how do you do it and what if this happens and what if that happens, and we're watching a video and all I could think of is how do I eat? Like what do I eat was my biggest thing, is what can I eat? Because I can't keep eating Taco Bell and Arby's. That's gone. So what does a human being eat now?
When meeting with the surgeon, you can expect him or her to evaluate your medical history, perform a physical exam, and talk about the different surgical options available. To ensure your safety, your surgeon will let you know if meeting with an additional specialist is necessary, such as a heart or lung doctor, depending on your exam and history. On the same day as the evaluation with the surgeon, patients will meet with the dietitian to learn about the diet they will be required to follow before and after surgery. The dietitian also discusses vitamin and mineral supplementation, hydration, and exercise to help avoid food-related complications after surgery. After meeting with the surgeon and dietitian, patients must also have a screening and assessment of behavioral health. During this visit, the behavioral health specialist will evaluate your coping mechanisms, lifestyle, and available support systems. Choose from our list of behavioral health providers listed in our patient information booklet, or schedule a visit with your preferred behavioral health specialist. Finally, prior to surgery, all patients will meet with pre-admission testing. During this visit, the anesthesia staff will review all of the testing to ensure it is safe to receive anesthesia. Best of all, your nurse coordinator will communicate with you through each step of the process. Now that we have reviewed the details of weight loss surgery, your next question may be, how am I going to pay for this? Understanding insurance coverage can be one of the most confusing and time-consuming steps in your weight loss surgery journey. For this reason, we have a team of dedicated insurance specialists to walk you through the process every step of the way. Our insurance specialists will contact your insurance company to determine if weight loss surgery is a covered benefit on your current insurance policy. Then they will work with you to set up appointments and compile the documentation required for insurance approval. Earlier in this session, we reviewed the appointments that our surgeons require before surgery. It is also important to know that many insurance companies also have requirements that must be completed before they will approve your surgery. One common requirement is called medically supervised weight loss. This means that your insurance company requires you participate in a weight loss program that is supervised by a physician. Not all insurance companies require medically supervised weight loss, but if yours does, our insurance specialists will help you determine how many visits are required before surgery. The medically supervised weight loss requirement can be completed through your own personal physician, or it can be completed at one of our 5 convenient locations. Patients who choose to have their weight loss procedure at university hospitals will receive all medically supervised weight loss classes at no cost, no co-payments or hidden fees, truly free of charge. What's even more exciting is that you can work on your medically supervised weight loss requirements and other program visits at the same time, so you don't have to delay your procedure. When it comes to payment, there are 3 main ways to pay for surgery. The first is through your health insurance policy. It is important to know that every insurance policy is different. Co-payments and out-of-pocket premiums may vary significantly. Our insurance specialists will help you to understand your policy details. At the other end of the spectrum is the self-pay option. With this option, people pay for the entire procedure out of pocket, typically because the surgery is not covered by their insurance policy. Self-payment is a realistic option, and our financial counselors are available to assist you with this process. The contact information for financial counselors is available in the downloadable patient information booklet located below this video. Right between the health insurance coverage option and the self-pay option is something called a capped policy. A capped policy is an insurance policy that covers weight loss procedures, but only covers a certain amount of the cost. For example, an insurance company may say, yes, we cover weight loss procedures, however, we will only pay $10,000 of that particular surgery. This means that all remaining costs are the patient's responsibility. Our financial counselors are available and happy to guide you through this process.
the best investment I ever made. It was not an expense. It was an investment in me. I do believe I have saved and made money by this gastric sleeve surgery. How do I save money? First of all, on food. My food bill is probably about only 20% of what it used to be. I eat in home much more. I cook much more. I cook for my family and friends more often. Clothes. I certainly don't buy as much clothes as I used to and as often as I used to. Prescription medicine. My prescription medicine bill probably was, and just with copays, $20, $25 per prescription. So about $100, $150 a month. So I no longer had that expense. I can't even begin to calculate the expense I save just on my health and not going to the doctors as often as I was. And the time now I'm saving by not going to the doctors. The money I'm making in my career. I can spend more hours at work, and not so much more hours at work, but the productivity of me is greater.
Without a doubt, weight loss surgery changes lives. However, obesity is a chronic condition. Weight loss surgery is not a cure for obesity. It is a tool to help you keep the weight off. Weight regain is possible after weight loss surgery. Typically, when we see weight regain in patients, it's because they have returned to their old habits, like eating high-calorie foods, drinking with meals, and excessive snacking.
To really be in a mind state that you're done being fat and unhealthy and miserable and depressed, and you have to want to be active and happy and more emotional and just physically in a better state.
The good news is, if you feel old habits coming back, our team of surgeons, nurses, dietitians, and behavioral health specialists are always available to help you get back on track. We understand this is a marathon, not a sprint, and we want you to be successful.
If someone is thinking about getting bariatric weight loss surgery, I think they need to sit down with either their spouse, a close family member, or a friend, and have a real heart-to-heart discussion as to why they think they need to do it, why they believe their life will be better, and what problems they've encountered by continuing their present path. I often tell clients I deal with, you have a choice. Do something or endure. And I think that's the question people have got to ask themselves. Do they want to continue enduring the life they have created for themselves now, or do they want to change it?
You have now completed the first step of our program. After watching this presentation, you may be interested in getting more information or starting our program right away. Either way, click on the Yes, I'm Interested link below this screen, fill out the online form, and submit it to us. After the form is complete, our office will contact you within the week to schedule your consultation appointment with the surgeon and answer any questions you may have at this time. Be sure to download the patient information booklet from the link below this screen as well. It has all of the information you need to get started. If you have any questions, please call us at 216-844-5274.
You can do this. You are worth it. It's best for you to start it as soon as you can. There's going to be tons of people to hold your hand throughout the way. The staff at UH is very encouraging. I've made new friends from other people who have had the surgery. Do it for yourself and do it as soon as you can.
Probably for 25 years, I was very overweight. I never ever could see myself as thin. Finally, I decided I wanted to see myself as a thin person, enjoy life, and enjoy my family and friends. And that happened. And it can happen for you.
Thank you for listening today, and congratulations on taking the first step to a new and improved life.